Eric Rogers was running marathons when his doctor told him he was pre-diabetic. At the time, he was also taking antidepressants.
You would lose enjoyment in things.
He started doing his own research and came across the ketogenic diet, a very low-carb, high-fat option. It's been around for 100 years, used to control drug-resistant seizures in people with epilepsy. You've likely heard a keto weight loss success story. Now there's a growing body of research suggesting it can ease mental health disorders as well.
It's actually not far-fetched at all to think, wow, well, if this diet can stop seizures in people, and it affects the brain in that kind of a way, maybe it could have a powerful effect for some people with psychiatric disorders as well.
Dr. Chris Palmer is an assistant professor of psychiatry at Harvard Medical School. He also practices at McLean Hospital. He's used the ketogenic diet for 15 years to treat patients with treatment-resistant illness. He says it didn't work for everyone, but for some people, he saw incredible results.
And some people were actually able to get off of medications and be in full remission from their illness.
Palmer says processed foods high in fat and carbs can negatively affect brain metabolism in anyone, leading to stress, depression, and anxiety. The keto diet removes those foods.
That results in an antidepressant or anti-anxiety effect for at least some people.
If you're feeling anxious or stressed, Palmer suggests paying attention to what you're eating.
Be more mindful about, for the next 2 weeks, I'm going to try to change my diet. I'm going to try to eat less processed foods, less junk food.
Eric Rogers cut out those foods 4 years ago and has followed a keto diet since. He reversed his prediabetes and was able to wean off his medication, and he believes it's the diet that did it.
If you're not happy with your health right now, you should be looking into this.
Dr. Palmer says while we know about that gut-brain connection, he's working on the science of why, along with many others, how diet can play such a powerful role in brain health and overall health.